for the Class A liquor license? Want to come up here?
Oh, sure. So I don't know if you're just pointing at me or like.
No. No, we want you on the hot seat.
Is this the hot one right here?
Next one.
Whichever one you're sitting. Okay, you're the new catering place. You want to, the Class A? Obviously, it's just in West Dallas events, correct?
No.
Yeah, it's for, well, it would be for, I think, the county, right? So we're licensed for the same thing through Wauwatosa. And so that would allow us to basically just store beer, wine, soda on our premises, and then we take that off-site. And anybody who contracts us to do a catered event at a place that's allowed to serve beer, wine, spirits, whatever that place is licensed for in the city, that would allow us to go there, serve it. We have our licensed bartenders, and we would serve them based on whatever they paid us for.
Okay.
Mr. Chair.
Alderman Weigel.
So, Wisconsin doesn't have a catering license as such,
Right.
so we have to give them essentially, he's a caterer, we have to give him essentially a liquor store license. The transactions still actually take place on your premises, correct?
Yep, yeah, people
Yeah,
pay
they
us
pay-
as,
they
yep,
come
it's on
there.
their invoice, like
Yeah.
all their food
Yeah.
and labor,
Yeah.
everything is itemized, and they pay us
there.
for it.
And then you
Yep.
essentially like deliver it to the location where it's gonna be consumed, and that's.
Yes.
that's- And like you said, anywhere in the county or anywhere in the state?
Well, we mainly do most of our stuff in Milwaukee County,
Yeah.
so I don't know if we would.
Doesn't really matter.
Yeah, and a lot of the places we work at now, they've, I guess they've kind of seen the light and they have their own licenses. But I'd say over the course of the year, it's maybe 12 to 15 events we might do. You know, sometimes at a park, or for example, like South Shore Pavilion at the park. Somebody rents out that park. They give us, they pay us, hey, we want 2 bartenders to serve beer and wine. We charge them a price for that. We go out and buy it, and then we bring it there, serve it, bring it back. So
You're not doing walk-up sales of 6-packs of beer or bottle of booze, because
Nope.
that's essentially the same license. I just want to make sure that everybody's clear on that.
yeah,
that's-
no, we're not gonna have anything for
Yeah.
sale. Just like right now, we don't have anybody that can just come in and order any food. Everything is by appointment only.
Yeah, it
And
can't just
basically,
have
and basically
a
it's just for,
cheaper-
yep, it's
yeah.
just for tastings of their menu for their wedding or something like that. So.
Move approval.
Second.
Wait a second, do I have any further discussion on
Mr.
this?
Chair, yes, but you
On the
could
road.
open a liquor store there if you wanted, correct? The license is there?
Yep.
Yeah, I don't plan on doing that.
Well, nobody ever does, but.
Well, but
We haven't done it. We had the same license in Tulsa. We never had anything for sale there. Anybody could. We were right on North Avenue, you know, busy corridor. We never had anything for sale where somebody would walk up and. It's not part of our business model or plan or anything.
If you
like
recall,
that.
we had another caterer come to us. a
The
couple
guy on
years
80th
ago.
and Lincoln.
Yeah. I don't know where he was gonna
80th
go.
and-
He ended up, he's out in Muskego or McQuantico now,
Mhm.
so Bub's Barbecue.
Oh.
Yeah. Yeah.
Oh, yeah.
He wanted to do the same, he wanted to do the same thing, and we were at our quota then, and I guess, I don't know if I'd call this an unintended consequence of us raising our Class A quota. I mean, we were thinking for large, grocery stores, but here we have a caterer here who's moving from Tulsa to West Dallas. So,
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. Thank you.
Guess he wasn't too hot.
just wait.
Just wait.
We have the, let's see, one more is not going to appear now. That's the second non-appearance.
So
both
move
times
for
she
summons
called.
and complaint.
Second.
No, this is for a renewal or a new
It's,
application?
No, there's a police
Police
report.
report.
Oh,
2 non-appearances.
And it's 2 non-appearances, but she called both times. She's sick this time.
Wow.
I don't know what the other one was last time.
Yeah, Mr. Chair, I would suggest since this individual called this time, is not just ignoring us.
They called us last time, too.
And called us last
I
time.
think we
Give
should
her a
make-
third time. There's not a fourth, but if she
Yeah,
doesn't
well,
come a third time.
I think we should make it a third time, but she should be known that she has to appear to this meeting. Okay.
She could send legal representation too instead. Is that allowed?
I don't know.
We usually call in the agent.
Not,
It's
I
always
was gonna say, I
allowed.
would think so.
Huh.
Full lawyer employment act.
That's right.
Sarah? Grohl? Okay. Pardon me?
Right, order of this, or-
Oh, yeah.
yeah, what, I'm not, item
Okay.
number?
Okay, it's just item number 45. We're taking all the appearances
okay.
first. Okay, this is a new
45.
license
Okay.
for bronze. bartending there now?
If there's somebody with a license, yeah.
Oh.
I'm not obviously allowed to be there by myself because I don't have a license.
I mean, I didn't.
I'm not allowed to obviously be there by myself.
Right.
because I don't have a license.
Okay, well, the reason why we call you in, because you did have the OWI,
Right. And as soon as I'm
and,
Yeah, Mr. Chair.
when did that happen?
It was in
April
2016.
Oh, yeah, I see.
Mr. Chair, if I may.
Well, on the speech.
Yeah, and so, right, the concern is you have one OWI. A big problem for this committee is, especially if an individual has 3 OWIs. Historically, if you have one OWI, you need to have a discussion. We know that at least at one point you made a bad decision for yourself
Oh, yeah.
and
Everybody else that was out there.
everyone else that was out there. And as a licensed bartender in our city, we're going to expect that you're always going to be making good decisions, not only for yourself, but also for everyone else in the tavern, everyone else in the establishment. Some other concerns, and this goes for everyone who's in the room who might have a license coming up before us. In the establishment, if you're ever thinking, should I or shouldn't I call the police, the answer at that point is you should call the police. And when the police come, you and your staff need to be cooperative. You need to be able to give a description. You need to be able to say, they went that way, wearing such and such. And you need to be able to tell them what happened and be cooperative. That should go without saying, but unfortunately it does need to be said. It does need to be reinforced. And with that, I would move approval.
Second.
Is there any further discussion?
Mr.
Or,
Chair,
Michael?
we'll also remind you there will be an occasion perhaps when you're working, when the police will send somebody in who's not of legal age, and you'll be tested on your carding consistency. I don't know what their policy is there, but a lot of places will essentially just fire you for serving a minor.
Yeah, that's
And
pretty much.
And you'll be stuck with the ticket too. So you'll have extra money to pay and no way to pay it.
Oh, yeah.
So it pays to card, or
Okay.
actually it doesn't pay to not card.
Right, exactly.
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries.
So tonight's actions will go to the council later this evening,
Okay,
and assuming your license be approved, which it will be,
okay.
it'll be available for pickup tomorrow in the clerk's office where you applied for it, or if you don't pick it up before, say, 2 o'clock, it'll be mailed off to your address of record. So
Alright.
you do not have the license until you actually have the
it in
license
my
in your hand.
Okay, alright, thank you guys, have a good night.
Yep.
Thank you.
Nathan Zetting
Second one, right?
is the second non-appearance, but this is also one that Nick pointed out that he's on probation with an absolutely sobriety and cannot possess alcohol, and he's going for a bartender's license
I put 2 non-appearances.
with 2 non-appearance. So we're
I
Move for
would move
denial
it to-
based on
2 non-appearances.
2 non-appearances.
I'll second.
And the record, yeah, I
Okay.
think on top of that, but
okay.
yes.
And second.
You second? Okay, any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. Orlin Root Dahlman? Dahlman?
I think the second one
Also
too.
the second.
Also the second one.
Move for denial
Second.
based on 2 non-appearances.
And Root seconds. Any further discussion? All in favor?
Aye.
Okay, then we have, item number 48. This was the super liquor and grocery. Now, the committee approved it, subject to necessary requirements. The Safety and Development Committee, rejected the, special use,
And the
which is
full
one of the
council, right?
requirements. And the full council did. And so, we just have to re-vote on this. And so obviously it's gonna be denial.
Yeah, Mr. Chair, I move for denial based on the failure to meet the necessary requirements.
Second.
Is there any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries. Then we have items 32, 33, 34, 35, 36, 37, 38, 9, 40, 41, and
Just a
Uh,
point.
41.
Move to place on file, Mr. Chair.
Second.
Do I have a second? Okay, is there any further discussion? All in favor?
Aye.
Any opposed? Motion carries.
Wait a minute though, we just, did we include number 41 in that?
You did say 41.
Because our note says that 41 we
Subject
should
to
approve
necessary
subject to necessary requirements and not place on file
Oh, do you mean on our cheat sheet?
on our cheat sheet, correct.
Uh,
I move to reconsider number 41 and to approve subject to necessary requirements.
Second.
any further discussion? All in favor?
Aye.
Anybody opposed? That's where that little paper clip was. Thought it was a practical joke. Okay, then we have item 42.
I move approval subject to necessary requirements.
Second.
Any further discussion? All in favor?
Aye.
Anyone opposed? Motion carries, and that is all. Motion to adjourn, license and health,
So moved.
Okay,
Second.
thank you.
all in favor?
Aye.
Opposed?
All right, and then I'll call administration and finance to order. All 5 members are present, starting with item 12, which is a joint referral with Public Works.
Move approval.
We have a motion from Alderman May. Is there a second?
Second.
Second from Alderman Rote. Any discussion?
Um,
All in favor say,
Mr. Chairman?
so, please, yes.
After the last meeting, someone asked, someone from the other committee asked a question, if this is a budgeted item, why does it have to come to administration and finance?
Yeah. I don't know the
Even
answer
though
to
it's-
that.
Even though it's budgeted already through Public Works.
This is something that Peggy and I will be discussing probably tomorrow when we meet. We haven't been able to meet since the last council meeting due
Oh.
to the, putting together the tax bills and so we'll have an update likely before
Oh,
the
okay.
next council.
It was just a question, cause somebody
Yeah.
asked that, and so.
Yeah,
okay.
it's still in the radar.
Same as that question was asked in Public Works. We said if it's a budgeted item, when we approved the budget, we already approved the spending for that particular item.
Right,
So now, all we're doing is approving, make sure that it was bid properly, make sure that the contract's right, and so it should only have to go to Public Works. In the past, that's all it's done.
yeah.
And all of a sudden, these started to appear, and we weren't sure why. We asked the same exact question,
Oh.
so hopefully we'll get to the bottom of it, and we won't have these joint referrals anymore.
Okay.
Thank you.
Thank you, Alderman Barzak. All right, we have a motion and a second. Any further discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. All right. And then item 13, request for interim director of public works to extend temporary employment of David Young.
Move for approval.
We have a motion
Second.
and a second. All right, Alderman Barzak, since I got you here, you guys placed this on file. Don't you want to approve it?
It was approved and placed on file.
All right, I'm gonna change that then.
If I did not,
Thank you.
check that one.
Thank you, sir.
You bet.
And so we have a motion and second, and any discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. And item 14, regarding ambulance fees. Chief Pooler, hello, sir.
It's different.
So item 14 and 15 go together. The first is the motion to open up the ordinance. The second one is an outline of the fees that will then go into effect if you approve the change. Kind of as a background, historically across the county, ALS, Advanced Life Support Billing, and DLS, Basic Life Support Billing, are handled in two different manners, and that's just due to the unique history of Milwaukee County. Across the county, the actual county government oversees the administration of advanced life support. So they contract with the local fire departments to provide that service. Basic life support we've been doing since the beginning of ambulances back in the 50s. So locally, we've always controlled those fees. In the past, the ALS fees were set every year by the ICC, the Intergovernmental Cooperation Council or Committee, something along that lines, who would recommend to the fire chiefs rates that they would bring back to their various municipalities and then be voted on. A couple of years ago, the ICC got out of the fee business and said, local fire chiefs, you guys set the rates at whatever you want to set them at. That opened the door to kind of break practice across the county of unified fees. So we've kept them in line the past couple of years, but this year one of our neighboring communities is going with a different fee model altogether, and they're drastically increasing their fees. Nobody else in the county wants to follow their example. We're just gonna kind of sit back and see how that unfolds. So the rest of the bigger municipalities in the county are going with the fees that you see in front of you. Some of the smaller ones don't feel that they can get those fees past their various governmental boards, so they're gonna go with a less aggressive fee schedule. But the bulk of the cities our size, I would say, and I've been asked to not specify who's gonna use what fee schedule, but I can tell you the bigger cities in the county are going with this fee schedule. I reached out to our billing company to compare those fees as to their other customers, and those rate surveys are attached, and you can see that we are definitely still, even if we adopt these fees, on the low end of municipal billing for EMS. So you have the fees in front of you. If you have any questions on any of them, I'm more than happy to try to answer them. It is about a 15 to 18% raise across the board, a little more aggressive than the average one. The past fee schedules that we bring to you every year are like 4 to 6%, and that's based off of CPI typically. The problem with that is medicines don't go up per CPI, so we're facing nationwide shortages on Narcan for overdoses, normal saline, just the basic IV fluids, epinephrine, things like that. So those are going up anywhere from 10 to 100% a year in pricing, depending on supply and demand on that. So that kind of justifies the fees that are in front of you.
Mr. Chair.
Alderman Weigel.
I see that we're kind of breaking it out more, like $2 for gloves and whatever for a CPAP and all that.
Right.
Is that the way it's gonna go now, kind of an a la carte?
That's the way it's been for the past year, and that was initiated by the local billing companies a few years ago. They recommended.
But it seems
higher.
like none of the other cities, at least in the comparison chart, were doing it that way.
That's a good question. Across the county, that's the way we've been doing it
Okay,
for quite some
okay.
time. I don't know the rest of the state, how they chose their billing model.
And that was my other question. I always like to see when we have a big jump in one year, I just wanna know, but you answered it, past, we typically would go with the general CPI.
Right.
But if you wanna call it, say, the medical CPI,
Right.
it's probably a little higher than.
Yeah, drug costs are going up faster than most other consumer products.
Alderman May.
So is the full cost of like the Narcan and those things, is that being borne by the patient? The full cost? Or is the city still bearing a cost for supplying
Depends on
those?
what they have for insurance.
Yeah.
Mhm.
So like 65% of our community is Medicare and Medicaid,
Mhm.
and those prices are capped at a much lower rate.
Okay.
But if somebody doesn't have insurance or if they're private pay, then they're gonna be paying a higher rate. So I think at the end of the day, we're still losing money on EMS, but this goes a long way to
Mhm.
reducing how much we're losing.
Any further discussion? Can I have a motion for items 14 and 15 together?
So moved.
Second.
Move approval, I should say.
Second.
Thank you. We have a motion and a second, and then any discussion after that? All in favor say aye.
Aye.
Opposed? Ayes have it. Thank you, Chief Pooler. And then item 16, we're gonna bring Chief Mitchell up. That's the resolution authorizing increased police budget to accommodate increase in sworn staffing levels to create a crisis assessment response team program. Yeah, and Chief, I think we've had a chance to read the memo, and I think it was a good memo from Captain Evenson.
Yep.
I was able to pull that out. But yeah, can you just tell us a little bit about that?
Sure.
More of a thumbnail of what this is?
Yep. So Milwaukee County Behavioral Health Division approached us for a partnership. They have been in partnership with the city of Milwaukee since 2013, where they gave funding for the salaries of Milwaukee police officers to get partnered in a car with a clinician and to respond to incidents involving mental health crisis. As they looked at their data on a county-wide basis, they have identified that we are a clear number 2 in the county, behind only the city, in terms of the number of admissions to people under Chapter 51 involuntary detaining by the police, turning over to Milwaukee County behavioral units. So they have approached us and they have offered 2 years of funding, capped at $100,000 a year, for us to provide a police officer to be partnered with a clinician from Milwaukee County, and they'll work an 8-hour shift together in the same car. And we have, the data is compelling in our city. Last year we had 634 Chapter 51, and in 2015 it was as high as 870, right around there. In 14 it was 875. So we fluctuate between 600 and 900 Chapter 51s in a year. We have the benefit that behavioral health partnered with the Milwaukee County DA's office starting in November, and the DA's office agreed that they would deploy in our city. So in the month of November, in 17 days of a DA investigator partnered with a clinician, they went to 29 different incidents in our city. So they went to a little over 1 a day, almost 2 a day. And in those 29, 2 people were taken for Chapter 51 at Milwaukee County. Now, we don't have a good way yet of telling how many of those 29 would have gone, but I would speculate it would be at least half. So right there, the savings of West Allis police officers not sitting at Milwaukee County Mental Health waiting for the patient to get admitted for treatment, which in a bad day, you can sit in the circular drive in your squad car for 3-4 hours waiting to even get into the building to get your patient admitted. One of the goals of our program, in addition to responding for the calls when people are actively in crisis, if they don't have a call to respond to, they will go and they will manage the known population, the people that we've dealt with last week, last month, last year, whatever it might be. And what they have seen in the city of Milwaukee is a reduction in the Chapter 51s. You can get people on a more stable footing and use their support systems to manage their health care short of having crisis and getting sent out. So from my perspective, it's a no-lose situation. We will analyze the heck out of it for the 2-year time period. We'll come back at the end of 2 years and we'll have one of 3 possible outcomes. The funding from the county will end. So the choice they'll have to make in 2 years is, do we discontinue the program? Do we continue the program just using existing police department resources? So do I take one person out of patrol and put them specifically on this detail? Or do we get additional funding from the council at that time? But what you would agree to today is a 2-year commitment. We would be back in front of you in a year and 9 months, give or take, telling you what our plans are and making a request at that time, or telling you we're discontinuing or doing it out of our funds. And I've got one good example that occurred with West Allis Memorial, where a patient of theirs that they felt needed to be Chapter 51. So they called the police department. We responded, and the CART team from the DA's office responded. The clinician made an assessment because they have a much higher level of training than we do. And the clinician said, no, this does not meet the criteria. So we left the hospital, we left the patient in the hospital. And a couple hours after that, we got a call at the station from a doctor who was very upset and wanted the person taken to Milwaukee County Mental Health. And on very firm ground, we said, well, they were there, and they said it doesn't qualify. So we believe it'll be a very beneficial program.
All right,
Alderman May.
What I'm hearing is freeing up officers to do other
Yes.
good work while also taking care of the Chapter 51. I think this makes sense.
Mr. Chairman.
Alderman Weigel.
Okay, in reading the memo, so we're talking about one person.
Yes.
Working a 40-hour week.
Yes.
So what happens when he's not on, and it's a Saturday?
We'll handle them like we normally do.
Okay.
And we still could rely upon the DA's office in certain cases for their CART team to come in, but we would handle it as we typically have for years.
Okay, and so Milwaukee County has given us $100K a year. That covers salary and some of his benefits?
No, it will cover, so here is the true cost
That's my question.
of the
I'm
program.
looking at retirement benefits eventually, also on an employee, because that's.
Yep. We will hire a new police officer at the lowest rate of pay that a West Allis police officer makes. And you take that annual pay for that officer plus their fringe benefits, which would include pension, it's about $89,000 a year. We will promote a current police officer to be a specialist
To be
one,
this
which would be about another $5,000 a year. So if you add that onto that, you're still under the $100,000. So the true cost is not the specialist that will do the work. That cost would be, perhaps $120,000 a year. I think the exact figure was $117,000 a year. The true cost is the new officer that we're gonna put on the streets.
Any further discussion? Can I have a motion?
Move approval.
We have a motion from Alderman Weigel,
Second.
second from Alderman May. Any further discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Thank you, Chief.
Thank you.
Item 17, resolution to amend the city's policy relating to the safety program. Rebecca, can you tell us about that?
Rebecca Grill, City Administrator. This is just updating the policy to remove the 3 committees that are listed within the policy. A lot of the topics that we typically discuss in these executive safety committee meetings are not something that we need to have a public agenda and public comment on, and having that in the policy does require us to do that pursuant to the Supreme Court opinion that came out, I believe, in June of this year. So this is just updating the policy to accommodate that.
Any questions? Can I have a motion?
Move approval.
Motion from Alderman May,
Second.
second from Alderman Rote. Any further discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. Thank you. Item 18, communication from the city administrator, transmitting security recommendations and reports for various city buildings.
With this file, there were several reports, one for Public Works, one for the Health Department, and one for City Hall. This, the City Hall report, I believe, is a subsequent report. The first, maybe there were reports before that, but the first report that I'm aware of was done in 2012, and we did do some updates, but they were very limited updates. A lot of what's the requirements that are in there will require financial resources to be allocated to them, and so the Executive Safety Committee felt it was very important for us to make the committee aware of what the recommendations are and get some input as far as direction and things like that. So as we're going through the capital improvement process for 2018, we can include those requests for that program. So I don't know if there were any specific questions that you had on the reports or feedback of things that you think we should focus on. I would appreciate some of that at this time.
So I'm going to start because I'm the chair. and so Rebecca, yeah, my concern, I read the report. Certainly, yeah, we need to improve security in our buildings. In the report about City Hall specifically, there was concern and a wondering of why in the stairwell, the glass stairwell over there, why is that open during business hours for folks to have access, and no one had a good answer. I guess they asked the custodian as to why that is. There's a very good reason for a building like City Hall to have a front entrance that's open to the public. It's important that buildings don't turn their back on the street and only work for folks who come in cars. Our Department of Development stresses that with all of our new buildings. They need to be pedestrian friendly, need to have pedestrian access. I realize we're not going to be acting on this tonight, but my concern would be that this building in particular, as it's laid out, needs to have that pedestrian access during business hours. Okay, Alderman May.
I was going to say, I'd like to see the costs put together. It was concerning with Public Works, just how accessible it is. And being down there, it's incredible. There were some things, not only the front, but the side doors. Those should be locked during the day with key card access only. And I'd be curious to see what it takes to do the key card system to access different departments and upstairs as well. So I thought the report was well put together, but let's see what it costs so we can get it in the hopper.
One of,
Oh,
Mr. Chair, I'm sorry.
yes, please.
One of the things that we have been doing with we receive a civic grant, we've received a $10,000 grant, matching grant, where if we do some type of upgrades to our security or something like that, Civic matches that. So this year we did install key fobs on some of the doors and things like that. We'll be expanding that next year. So we do have $20,000 allocated. We're actually going to be talking about that at our Executive Safety Committee meeting on Thursday, and we'll be moving forward with some of those options. I believe there are some hardware upgrades for that, which might need to occur before we expand to the door, but we can definitely put something together.
At least, can we at least start locking those doors? I mean, I understand that employees like to go out and maybe have a break, but I'm talking about the two side doors. I saw in the report that those were not being locked.
The
Those ones
doors,
you want
those are
left
the
on.
one that Alderman Haas was referring to. Those
The
are
one in the
by
art gallery,
glass.
but there are two side ones that the
Those are-
employees use. Those should be locked.
Those are those.
With the
Got it.
stairs
They
you have to
got
go up
thought,
to,
yeah.
those should be locked.
So
Th- th- those-
I
tho-
need
those
someone
are-
else to weigh in on that.
Mr.
No.
Chair, Mr. Chair,
Yeah, Alderman Weigel.
as the guy that lives in the neighborhood and I see what goes on in the courtyard, I'd vote for locking the doors.
Which doors?
The ones that,
The side ones, I'm not talking about the art gallery.
I'm talking about the
two
art
side.
gallery, I'm talking about the art.
The art gallery, is locked.
It's the
I
We're
know,
talking
the-
about the
the
stairwells,
breezeway, the breezeway. I would,
Yeah.
I mean, I would lock those breezeway doors.
One of the thoughts was to have a lot lot of signage in the
Yes.
courtyard.
If they're locked, they need signage.
Showing
Yes.
people that their entrance could be, and they could come to the rear of the building and come through the parking lot. As I sit in my office on a daily basis, I see people walking all around that area, getting
Trying all the
confused, trying to get in all the doors. It's just, regardless of whether we lock those doors or not, I think we need to have some signage
more
to,
signage.
yeah, it's just not friendly to the citizens coming to visit City Hall.
Yeah, I would suggest even signage on the street for people who may come on transit, especially people with difficulties in getting around, whether in their wheelchair. I wouldn't wanna send somebody down there and then tell them they have to go back up and around the stairs and all that. But I think the report's a good start. I think decisions are gonna need to be made about whether we want a manned desk in the hallway here. I mean, but I think it's a very good start.
Any further discussion? Can I have a motion to place on file?
So moved.
Second.
A motion from Alderman May and a second from Alderman Weigel. Any discussion? All in favor, say aye.
Aye.
Opposed? Ayes have it. Item 19, communication from the city administrator to fill a project manager position in the IT department.
Move for approval.
Second.
Motion from Alderman Chaplesky, second from Alderman Weigel. Any discussion? All in favor, say aye.
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 Opposed? Ayes have it. Item 20, another communication about getting a PC technician.
Move approval.
Second.
Motion and a second. Any discussion? All in favor say aye.
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 Opposed? Ayes have it.
Mr. Chair, move approval of 21 and 22.
Second for both.
Thank you. Okay, we have a motion and a second. Is there any discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. And item 23, the comptroller report. Can I have a motion to place on file?
So moved.
Motion
Second.
and a second. All in favor say aye.
Aye.
Opposed? Ayes have it. And the city attorney claim report, can I have a motion to take items 24 through 27 as identified in our agenda, specifically 24 to place on file, 25 to deny, 26 to deny, and 27 to place on file.
So moved.
A
Second.
motion and a second. All in favor say aye.
Aye.
Opposed? Ayes have it. And we will be meeting as a committee on this coming Monday at 6 p.m. right here. And so, see you all then.
Move to adjourn.
A motion to adjourn, is there a second?
Second.
All in favor say aye.
Aye.
All right, thanks everybody.
I'm sorry, I didn't hear you. What?
I was saying when they give us